Vaccination of Canada's homeless population has started in various parts of the country, including Toronto. It started just days after the group was prioritized in the Phase 1 stage of vaccines. Dr. Andrew Bond was on the ground yesterday in Toronto taking part in the vaccination effort. He's the medical director of Inner City Health Associates and a group of physicians working in local shelters and drop-ins. He's also the co-chair of the Canadian Network for the Health and Housing of People Experiencing Homelessness. He joins us from Toronto. Dr. Bond, thank you for your time. Really appreciate it.
Thanks, John. Thanks for having me.
It's our pleasure. How did things go yesterday?
Things were a resounding success. It was a great operation that was a collaboration between Parkdale Queen West Community Health Centre, University Health Network, and our organization, Inner City Health Associates, at a women's residence in downtown Toronto, and went incredibly well with very high uptake of vaccines, lots of very ecstatic both clients and staff as well. So resounding success.
Yeah, you say ecstatic clients as well. What do you hear from the clients in terms of getting their shots?
Yeah, this has been obviously a very difficult year for people experiencing homelessness, with the fear and uncertainty and the risk that they've experienced along the way over a very long year. And so I've been waiting a very long time for an opportunity to be safe from the COVID infection. And so many clients were just really glad to have the opportunity to get the vaccine. And we're really engaged in we had a very short timeline between when the announcement was made to be able to move ahead with this and to actually implement the operation. And so to see that kind of uptake very quickly was incredibly encouraging.
Being on the street is fraught with jeopardy at the best of times, but can you just give us a sense of what it has been like being homeless during a pandemic?
So I'm certainly not the best position to speak to the direct experience, but certainly from what I know and hear from across the community and sector, we know that it's been frightening, it's been confusing. There's been a constant movement and fragmentation of support services and where people might stay, and the usual challenge that exists without COVID or a pandemic situation has been only that much more chaotic for people, with that added layer of fear. And so certainly it's been an extremely difficult experience for everybody, and for understandable reasons. We've been working with many different organizations in the community and on the street to try and advocate to try to both move people into housing as quickly as possible and get people access to vaccines, which is a great point that we're in now to be able to really start moving forward in earnest with that.
Yeah, there's people experiencing homelessness added to that priority list. So what was your advocacy like in terms of getting them added to the list?
So ourselves, along with many community partners, hospital partners, have been advocating both locally to public health units and provincially to the ministry and to the vaccine task force, but also nationally as well. The Canadian Network for Health and Housing of People Experiencing Homelessness has been working with the Canadian Alliance to End Homelessness to really push on provincial governments right across the country to see this change, to write letters to members of parliament and provincial parliament. So I've been really working over the last 6 to 8 weeks to really push hard to say, we know that folks who are experiencing homelessness have all the kinds of public health guided risks that would need prioritization, both with their risk of acquiring the infection, having a severe outcome from the infection, but also knowing that outbreaks in the shelter sector and the homelessness sector can really not only cause challenge in the shelter itself, but also propagate out into the wider community. And so it's in everybody's interest to see people experiencing homelessness vaccinated, to keep everybody, including the most vulnerable, safe.
Okay, until the J&J vaccine gets out there, the one shot, of course, there are 2 shots that are needed. So what's the process like to trace people and to ensure they do come back for their second shot?
That's right. So it's incredibly complicated, obviously. It's encouraging to see the evidence that even with one shot of the Pfizer vaccine, for example, you have a fairly strong impact, even equivalent or near equivalent to the J&J vaccine. But that being said, we're going for both shots for everybody. The way that we're going to have to be doing that is to ensure that we work very closely with our colleagues in the shelter support and housing administrations and various shelter administrations across the country, so that we have a dashboard that keeps track of, within any given shelter, what proportion of individuals have one dose of vaccination, both doses of vaccinations, or none. so that we can keep close track and follow up with each of those shelters to ensure that everybody has the doses. So rather than following each individual as an individual, we're going to be able to follow the sector as a group.
When this pandemic is over, as we all hope that it is soon, do you think that the lessons learned will be followed through on, especially when it comes to marginalized members of society?
I absolutely hope so. And there's certainly some encouraging movement in that direction. We know that with our municipal colleagues, there's really a push towards trying to find alternatives to sheltering and to move people towards housing options. And so that's been really encouraging to see. The provincial government's invested in this space as well and really push hard. And we know that the federal government with the Rapid Housing Initiative and their the housing strategy and homelessness strategy as well is all very encouraging, that the right kinds of things are in place, because we know that definitive housing solutions are going to require both municipal, provincial, and federal cooperation and the budgets and to be able to deliver on that. And right now, the right kind of framework is coming into play to see that. And we know that we're going to have to establish the public health practices that are going to be able to prevent this happening in the future. And I think that the lessons learned throughout this pandemic has really given us an opportunity, despite this tragedy, to be prepared better for the next time. And certainly there's been an immense amount of collaboration between the community health sector, hospital sector, municipal services, and the provincial governments across the country. And so while it's been a very difficult experience, I really hope to see that we're going to be able to take this going forward, to be able to be ready just in case we're going to see this ever again in the future. And we know it's a long road still ahead.
Dr. Bond, I'll let you get back to work. I want to thank you for your time. Appreciate it.
Thanks so much. Appreciate it. Take care, John.
Dr. Andrew Bond is the medical director of Inner City Health Associates in Toronto.